Rachel Jacob. I'm a nurse practitioner working at a pulmonary clinic. As we observe November as Lung Cancer Awareness Month, I would like to highlight the importance of lung cancer screening. Lung cancer is the second most common cancer in both males and females in US, next to breast cancer and prostate cancer. And by far, this is the leading cause of cancer deaths in the US population, accounting for about 1 in every 5 of all cancer deaths. Lung cancer usually has generally a poor outcome or prognosis, with an overall 5-year survival rate of 20.5%. So good news is that lung cancer found in its earliest stage has a cure rate as high as 90%. The median age of detection of lung cancer usually is 65 to 70% in US population. And in Indian population also, lung cancer is the 1 in 4 most common cases of cancers, and again the leading cause of cancer deaths, and usually detected in mid-50s, at least a 10-year decade earlier than the Western population. And usually by the time it is detected, usually it is a 3rd stage or 4th stage, and it is a little too late for a better outcome. Again, lung cancer can go unnoticed or undetected for a very long time because symptoms usually do not appear until the cancer has spread. So if you are over 50 and if you have a history of smoking, you are already at risk for developing lung cancer, and you may be eligible for a lung cancer screening. So the US Preventive Services Task Force recommends yearly low-dose CT as a screening tool, and you may be eligible if you are between age 50 to 80 and with a history of smoking 20 pack years or more, whether you are a current smoker or quit within 15 years. So that means if you smoke 1 pack a day, that is 20 cigarettes a day for 20 years, means 20 pack years. For example, if you smoke 2 pack a day, that is 40 cigarettes a day, for 10 years equals 20 pack years. So like that, if you smoked 20 pack years or more, current smoker or quit within 15 years, and if you are between 50 to 80, then you are eligible for yearly lung cancer CT scan. And most insurances, most private insurers and Medicare covers the low-dose CT every year for eligible people. So like in any other cancer, early detection ensures a better outcome, and when it is in the early stage, it is more likely to be curable. So in lung cancer screening, we are looking for cancer in people who are at high risk before they have any symptoms develops. So there are different risk factors for put you at risk for developing lung cancer, including smoking, occupational exposures like exposure to asbestos, chemicals, metals, fumes, gases like radon, and pollutions. But as you all know, smoking is the most important risk factor for lung cancer screening, and smoking is estimated to account for about 90% of all lung cancer cases, and it increases the risk by at least by 10 times more in smokers than in non-smokers. So the best way to prevent lung cancer is by quitting smoking. So no matter how long you have used tobacco, quitting is the best way to reduce the risk of lung cancer and also other chronic lung diseases. So also it is very important for you to discuss with your physician to see if you are eligible for lung cancer screening, and also the risk associated with the screening. especially, every year getting the CT scan increases the risk for you are exposed to radiation. So the radiation exposure itself is a risk factor for developing cancer, especially lung cancer. So it should be a shared decision making between you and your physician. So by emphasizing the importance of quitting smoking, even the risk of secondhand smoking, early detection by screening test, and also watching and reporting promptly the early symptoms of lung cancer, such as a cough that doesn't go away, nagging cough, or difficulty breathing, or chest pain, or unusual fatigue or tiredness. These all are early symptoms, and it needs to be promptly reported to your physician. That way we can ensure a better outcome for ourselves and also for our dear ones, and for a better future. Thank you so much.